Nurses have been using technology for many years to aid and inform their practice. Probably from the very first sphygmomanometer or blood pressure recording machine right up to and including cardiac monitors, ECGs, blood glucose monitors that we use now. The 21st century has seen us move into and think about and develop how else can technology help us into the future to guide and aid patient care. In the remote and rural area of Dumfries and Galloway, what this has meant is the development of video conferencing technology or office communicator software. What we're doing then is from Stranraer to the Dumfries and Galloway Royal Infirmary is set up patient access clinics so that diabetic consultants, neurology consultants can actually run their clinics based in Dumfries straight out to the Galloway Community Hospital in Stranraer using video technology. The patient will be in Stranraer, so that's negated the need for a 152-mile round trip for both them and or their relatives. Likewise in reverse, it's negated the need for the consultant to undertake that 152-mile round trip. It's just like being in the room with a consultant. The patient is sitting just like I am talking to you now on video, and the consultant can respond and reply. Further technologies back this up. So for example, in the diabetic clinic, another technology system is used to download data from the patient's blood glucose monitor. That immediately is streamed through to Dumfries for the consultant to review. Advice can then be given based on that information to aid the patient's healthy lifestyle and how to manage their diabetes. Similar is done with weight management, and we're about to test and trial how sleep clinics can be developed further in this way. In big terms, we're leading the way in Scotland on video conferencing and teleconferencing outpatient clinics. Other things aid and could be improved on with technology, however. One of those things that we find, if you think of technology slightly differently, is nursing documentation. So previously we've thought about nursing documentation as just a record of what the nurses have done for a patient. Starting to think very differently about that now. It's actually a record of what have we agreed and planned with the patient to be their care for the time that they're with us, for that care episode. We currently use systems which are quite clunky. They take a lot of clicks, as nurses would say, to get into each aspect of that care record. And because it's got to be done on a computer, it means that it can't be done at the patient's bedside with the patient. So in terms of innovation in Dumfries and Galloway, we are looking at a radical review of nursing documentation. For us, what that means is not throwing the baby out with the bathwater, but keeping certain aspects of that. So we're certainly looking to keep the nursing process in place, and what that means is that we would still be looking to assess the patient with the patient giving us information to guide that. We'd be looking at implementing an agreed plan of care with the patient that's actually going to achieve an outcome for the patient that they want and that we feel is beneficial as well, and an ongoing evaluation of that care to see how the patient are responding to the plan. That's great. How do we record it? Well, at the moment, as I say, it's on this very clunky system. How can we change that for the future? Let's throw that out. Let's look at how we document on paper and then move to electronic. Looking at innovations such as e-pen technology, looking at electric paper. It's the only way I can describe that. But what it means is that that pen can write in biro in a patient's home, but also magically appear on a computer screen back at base in the office. Now, when you think of community nurses, what that means is they're not having to keep going back and forward to base to write these notes up, that the patients have access to it in their own home, that it's all done live. Everybody knows exactly what's going on with that patient. Thinking about then how that can be transferred into a hospital setting leads us to think about iPad technology, or any other brand for that matter, and how that e-pen or just a stylus can mean we don't have to sit and tick boxes or drop down fields or have pre-prepared care plans. What it means is we can actually really use the information that patients are giving us and handwrite on a pad technology just exactly what the plan of care is agreed with the patient. That allows us to think in a more patient-focused way, and get that all captured live at the time and using Wi-Fi transferred to the computer base. What that means is that we actually can be sitting with patients, having good, live, real discussions with patients about what they want, what they need, what they want as an outcome, that we can then help plan towards. It's not us saying this is what the patient needs, it's an agreement between the two, captured electronically using nice modern technology that's not hard to use because handwriting's handwriting, and that will inform practice for the future.